Never make these 9 blood test mistakes, or you'll regret it. Are you over 60 and having regular blood tests? If so, you might be missing out on vital information that could save your life. Blood tests are one of the most important tools in monitoring your health, but many seniors make mistakes that could lead to inaccurate results, or worse, missed health issues. Today, we're going to break down 9 blood test mistakes that seniors over 60 should avoid. If you're ready to make sure your next blood test gives you accurate, actionable results, keep watching. And don't forget to like, subscribe, and drop a comment below with any blood test experiences you've had. Mistake number 1. Not fasting when required. The first and most common mistake many seniors make is not fasting before a blood test. When it is required, certain blood tests, especially those that measure glucose levels, cholesterol, or lipid panels, need you to fast for 8 to 12 hours before your test. Why is fasting important? When you eat before these tests, your blood sugar and lipid levels can spike, which can give inaccurate results. For example, if you're checking your blood glucose for diabetes, eating before the test can cause a falsely high reading, potentially leading to unnecessary medication or treatments. How to avoid this mistake? Make sure to follow your doctor's instructions carefully. Drink only water before your test, and avoid eating anything the night before if fasting is required. Double check with your doctor if you're unsure whether fasting is necessary for your upcoming test. Mistake number 2. Taking medication without consulting your doctor. Many seniors take their daily medications without considering how they might affect their blood test results. Blood pressure meds, cholesterol-lowering drugs, and even vitamins can influence the outcome of certain tests. Why is this an issue? Some medications can interfere with blood test results, causing misinterpretations that could lead to incorrect diagnoses. For example, certain blood thinners can affect your INR levels, international normalized ratio for clotting, and statins may alter your cholesterol readings. How to avoid this mistake? Before any test, tell your doctor about all the medications and supplements you are taking. They might ask you to temporarily stop taking certain drugs before the test to ensure accurate results. Mistake number 3. Not being prepared for multiple tests. If you're going for more than one blood test, don't make the mistake of not being prepared for all of them. Some tests require special preparation. Why is this an issue? For instance, thyroid tests or liver function tests can require specific conditions like fasting or specific timing of the day for the most accurate results. Not preparing accordingly can cause delays or false results that could impact your health management. How to avoid this mistake? Ask your doctor to explain which tests are being performed and what steps you need to take to prepare. Ensure you know the timing, whether you need to fast, or if there are any special instructions to follow. Mistake number 4. Not asking questions about your results when you get your blood test results. Do you fully understand them? Many seniors make the mistake of not asking enough questions about their blood test results. Why is this an issue? Blood tests can reveal important markers related to your overall health. Without fully understanding your results, you might miss a warning sign that could lead to serious health issues down the line. How to avoid this mistake? Don't leave your doctor's office until you fully understand your blood test results. Ask about any abnormal values, what they mean for your health, and what steps you can take to improve them. Be proactive in understanding what's going on inside your body. Mistake number 5. Ignoring symptoms before the test. Many people think they need to be asymptomatic to take a blood test. But if you're already feeling unwell or experiencing symptoms, you should tell your doctor. Why is this an issue? Ignoring your symptoms could lead to a misinterpretation of your results. For example, if you're feeling fatigued, it could affect your iron levels or thyroid test results. Some conditions, like anemia, can show up in your blood tests, but only if your symptoms are reported properly. How to avoid this mistake? When scheduling your blood test, make sure to share any symptoms you're experiencing with your doctor. This helps them tailor the tests to give you the most accurate picture of your health. Mistake number 6. Not keeping track of your previous results. As you age, your blood test results become more important for tracking your overall health. A big mistake seniors make is not keeping track of their previous blood test results over time. Why is this an issue? Not having a record of your past results can make it difficult for you and your doctor to track trends. For instance, if your cholesterol levels were slightly elevated 6 months ago, it is important to compare them with your latest test results to see if there has been improvement or deterioration. How to avoid this mistake? Keep a file or digital record of your past blood test results. Bring them with you to your appointments so you and your doctor can compare them and monitor any changes. Mistake number 7. Not following up on abnormal results. One of the biggest mistakes seniors make is not following up on abnormal blood test results. It's easy to get distracted by daily life, but this could mean missing early signs of health issues. Why is this an issue? Ignoring abnormal results, especially if they show things like high blood sugar, high cholesterol, or poor kidney function, can lead to serious complications. Left unchecked, these conditions can progress into chronic illnesses that could have been managed or prevented with early intervention. How to avoid this mistake? If your blood test results come back abnormal, make sure to schedule a follow-up appointment with your doctor. Ask what changes you can make in your lifestyle, diet, or treatment plan to improve your results. Mistake number 8. Taking the wrong time of day for your test. Did you know that the time of day can affect your blood test results? Some tests, like hormone levels or glucose testing, can vary depending on the time of day. Why is this an issue? Your body's chemistry fluctuates throughout the day. For example, glucose levels can be higher in the morning, and hormones like cortisol can fluctuate depending on when the test is taken. Testing at the wrong time can lead to inaccurate readings. How to avoid this mistake? Ask your doctor when the best time of day is for your specific test. This is especially important for tests related to hormones, blood sugar, and lipid levels. Mistake number 9. Not preparing for special tests. Certain tests, such as vitamin D, B12, or iron studies, require specific conditions for the most accurate results. Not preparing for these special tests can lead to poor results. Why is this an issue? If you don't prepare correctly for a test, it may not be as effective in providing the insights your doctor needs. For example, vitamin and mineral tests can be affected by recent food intake, dehydration, or medication. How to avoid this mistake? Always ask your doctor about any special requirements for your upcoming tests. This might include fasting, adjusting medications, or drinking extra fluids before your test. By avoiding these common mistakes, you can ensure that your blood test results are accurate and helpful in managing your health. Remember, blood tests are one of the most powerful tools in detecting potential issues early, so it's essential to approach them with care and attention. If this video helped you understand how to prepare for your next blood test, be sure to like, subscribe, and share it with your friends and family. Have you made any of these mistakes before? Let me know in the comments below. And don't forget to ask any questions you have. Together, we'll stay informed and healthy.